Our coverage of the coronavirus pandemic takes us now to New York. The U.S. Navy hospital ship Comfort sailed into New York Harbor today. New York's Governor Andrew Cuomo is asking medical volunteers to come forward to help. The number of dead in New York is now more than 1,200. Most of those deaths happening in New York City. While we're not in a situation like New York, there is plenty to worry about for our doctors, nurses, and other medical personnel.
CBS 4's Jim DeFede spoke today with Martha Baker. She is the head of the union that represents more than 5,000 Jackson Health employees. Here's part of their conversation.
Tell me about Sally, the ICU nurse who passed away.
Yeah, we all knew Sally as Sally Buendia, and Buendia is good day. She was one of those hands-on assistant nurse managers who would not let you work by yourself. She was probably going in and out of every single room in that 20-bed ICU every day, despite the risk of COVID. Not only is she a good friend of mine and a good friend of many, she's our first. She's our first to fall. And that's hard.
How are people dealing with it? I mean, it's got to rattle folks as I see the emotion on your face, and how are others at the hospital coming to grips with not just this first death, but the possibility that this may not be the last death among healthcare workers?
I think everybody recognizes, sadly, that she may not be she's the first, but she may not be the last. And we just have to be extra careful. These patients coming in, we're not able to test everyone. We're not able to test each other as coworkers. Well, who did you, bring from home? What did you bring from home? And, we're finding, everybody's heard about the Jackson North nurse that was COVID, and she was at work and didn't know she was positive. She went home sick and was 6 days with her family and didn't know she was positive. You don't find these things out, and then in retrospect you realize how many people you touched, and literally touched.
Well, after Sally passed, you had said to me, and I just want to make sure I get the words correct. You said the richest country on earth can do better than this. What did you mean by that?
Well, and I don't want to get partisan on this, but I'm disappointed in our leadership of this country that they blew this off, going to be done by April, 15 people, it's just going to go down to 0. We should have been learning and listening.
Do you have enough N95 masks? Do you have enough ventilators should your ICU capacity have to double? Do you have that type of equipment that can mean the difference between life and death?
Well, management assures me we have the N95s. And all the other supplies. And I'm hoping, I think N95s we've heard are probably the tightest. Hopefully within the next, 2 weeks, 4 weeks, manufacturing has picked up in this country, right? I can understand it takes a bit. It goes back to that mistake of letting a month or two slide by on the front end.
What sense do you get from the doctors and nurses you represent in terms of how nervous and scared they are right now?
Yeah. Well, I tell you, I'm so proud of all of them. When they call, they don't talk about themselves. They talk about needing, equipment to do their job safely. I'm sure they got to be scared. They're human beings, but that doesn't bubble to the top of our conversation. And if I were to ask them, how scared are you? That could probably be a whole nother conversation. But they're healthcare professionals, just like the first responders. I mean, when 9/11 was happening, we didn't ask the firefighters, are you scared? I don't think. We talked about what a heroic job they're doing and how are they dealing with this stress and how do we keep them safe. And they're a lot of the same. I mean, I think we could, I think every one of them has to have in their back of their mind, how can I stay safe? And how do I know I don't take this? I know some employees are self-quarantining themselves even from their family at home. And people are mostly saying, the PPE, it's not showing up fast enough. They're feeling like it's not there. And I'm trying to convince them and push on management to deliver it faster. But, they're talking about, how do we stay safe when we found out that one of my coworkers was positive, a doctor was positive. Who gets tested? Do we all get tested? How do I know I worked with him side by side? How do I find out if I'm positive? But they're not, I think they're really concerned about how do we keep this manageable? How do we, every strategy is to stop it from spreading. And if we don't know who has it, how do we do that?
That's Jim DeFede reporting there with Martha Baker from the union at Jackson Memorial Hospital. You'll be spending less on